Hello, my name is Nurse Pauline RN. Welcome to my channel. Today we'll be talking about Exam 2, Part 3. Please check my playlist for Exam 1, Exam 2. Thank you. Today we'll be doing questions and answers. Before I get started, please hit the like button. Please subscribe if you have not subscribed. Please share my video. Thank you. Okay, a nurse washes her hands, puts gloves on before inserting a Foley catheter. Which example of Maslow hierarchy of needs is this? The answer is safety and security. In exams, the answer for hand washing is always safety. We are protecting the patients from bacteria. An African American client complains of gas after eating cheese and drinking milk. This may be a symptom of which condition? The answer is lactose intolerance, lactase deficiency. The next question is, health can be defined as in terms of a feeling state, absence or presence of symptoms, or ability to carry out activities of daily living. Define health. Health can be defined as in terms of feeling state, absence or presence of symptoms, or ability to carry out activities of daily living. What are morals? Morals are personal standards of right and wrong. What is a moral dilemma? A moral dilemma is two or more clear moral principles applying but support mutually inconsistent courses of action. Two or more clear moral principles applying but support mutually inconsistent courses of action. This is a moral dilemma. What are values? Value is a personal belief about worth that acts as a standard to guide one's behavior. This is called value. What is ethics? Ethics is a systemic inquiry into principles of right and wrong, conduct or virtue, and vice, and of good and evil as they relate to conduct. Ethics are a systemic inquiry into the principles of right and wrong conduct, of virtue and vice, and of good and evil as they relate to conduct. What is the reason for filling out an incident report? For example, your patient falls. Just a minute, please. When your patient falls, even if their small finger touches the ground, that's a fall. When your patient falls, you have to fill out an incidents report. If you give your patients the wrong medication, you have to complete an incidents report. If you experienced a needle stick when you were giving your patient an insulin injection, you have to complete an incidents report. The question is, what is the reason for filling out an incidents report? The answer is to improve quality of care for your patients. When clients are transferred within or among healthcare setting, which is most important to ensure continuity of care? The answer is accurate and complete communication within healthcare workers. When you have a patient who is very sick, for example, and you're going to transfer your patients from a med-surg floor, maybe to ICU, you have to clearly give good communication, good handoff report. Everything about your patient must be completed from the sending nurse to the receiving nurse. If you have a patient and your patient is very sick and the family say, I don't like your hospital, I need to transfer my mom right now to another hospital. When you're transferring your patient to another hospital, there have to be clear communication between one nurse to another. Clear communication, communicating from the receiving nurse to the nurse who is sending the patient to the nurse who is receiving the patient. So we need clear communication from nurses who are transferring patients. Which source of clients' data is usually the primary and the best source? The answer is the client's source. The client's source. Whatever the patient says is right. What the patient says is what it is. Which source of client's data is usually the primary and best source? The answer is the client. What fruit is best given to the patient to prevent UTI? Which fruit do you know prevents UTI? The answer is cranberry juice. Which fruit do you know is high in potassium? That fruit is banana. Banana is high in potassium. We're talking about diet. Cranberry is good to prevent urinary tract infections. The doctor has ordered a PSA test in a male patient. What is the use of a PSA test for a male patient? A PSA test is used to detect prostate cancer or prostate enlargement in male patients? Which group of patients are considered elderly? What age group of patients are considered elderly? The answer is over 65 years old. When you are administering an IM injection, what's the correct angle? For an IM injection, the correct angle is a 90-degree angle. What is the correct angle for administering a subcutaneous injection? A sub-Q injection, the answer is 45-degree angle. The next question is, before administering medication to your clients, what should the nurse identify the patients by? Before you administer your medications, the first thing you do before you administer your medications, you check your patient's identification bracelet. You make sure you have the right person. When a patient is admitted to you, maybe coming from the emergency room, if they come with a whole shoebox of medications, what do you do? When patients are admitted and they bring their medications from home, we have what's called a medication reconciliation list. What we do is write off all the patient's home medication. We write all their medications that they are taking from home. After we're finished, we give the medications back to the families to take back home. Those medications can be very expensive, some of them. So we do not want them to get lost. We do not want to be responsible for this medication. The thing you do is send these medications home. If there's no family members, the nurse, there are safekeepings that we have lock and key for these medications to be stored. Do not leave them at the bedside. Some patients will be happy to be taking the medications in their pocketbooks and the medications that we are also giving them. That is at risk for overdose. All medications must be sent home or kept in safe keeping. We do not keep meds at the bedside. Which drugs can cause electrolyte imbalance? Which drugs can cause electrolyte imbalance? The answer is diuretics. In emergency situations, if there's no consent at the bedside, if there are no consent in the patient's chart, if the patient maybe the patient is going for a procedure, if there's no consent in the chart, if the patient is too sick, if the patient is not mentally alert, if the patient is not able to sign their consent for an emergency procedure, maybe surgery, the doctor can make an emergency telephone call to the family or next of kin to get an emergency consent over the phone. Okay, we're talking about OR. Do you know who the scrub nurse is in the OR? In the OR, the scrub nurse is the nurse who assists the surgeon during surgery. The scrub nurse maintains a surgical asepsis while draping and handling instruments and supplies. Do you know who a circulating nurse is? A circulating nurse in the OR is the nurse when we send our patients to the OR. The circulating nurse is the nurse who admits the patient once the patient gets to the OR. The circulation nurse helps to position the patient on the table for surgery, helps with monitoring devices, gets additional supplies, and count the number of needles, instruments, and gauzes and sponges used for the procedure, used for the surgery. For surgical patients, we are talking about dehiscence. DEHISCENCE. For dehiscence, dehiscence is partial or total disruption of wound layers. Post-op patients, maybe with abdominal surgeries, you'll find these. The wound starts opening out. What you do, if you notice this, it's just open from the staples. You call the doctor immediately, and you always stay with your patients. Do not leave the patient's bedside. You can call another nurse to ask another nurse to notify the doctor. This is wound dehiscence. Wound eversation. Wound everseration. Wound everseration. EVISERATION. EVISCERATION. Wound everseration. This is protrusion of viscera through the abdomen, through the incision area. Internal organs are protruding through the abdominal wound area. In this case, this is an emergency. You will call the doctor, or you will have another nurse call the doctor, but do not leave the patient. If your patient is experiencing any distress, shortness of breath, difficulty breathing, a lot of pain, before the doctor comes, call the meds team. This is an emergency. We are having protrusion of internal organs through a surgical wound. And I did mention abdominal pillars in our previous videos. Post-operatively, patient uses abdominal pillars. They will place it towards their abdomen when they are coughing, when they are sneezing, when they are laughing, when they are moving up and down out of bed to support their abdomen. This causes movements, usually causes pain on patients with abdominal surgery. So these patients can experience the wound edges opening out, or some patients can experience protrusion of internal organs. So please let your patients use your abdominal pillars post-operatively. When using an embolism stocking, when you're going to place an embolism stocking on your patients. Your doctor gave you this order. Place an embolism stocking on this patient. It is important to know that if the client has been up and about walking all throughout the day, when the patient gets back to bed, we place the embolism stockings on the patient when they are in bed. When the patient gets back to bed, they will elevate their feet for 15 minutes before applying their stockings. Which clients are at most risk for developing pressure ulcers, pressure injury? The answer is the critically ill clients, the patients who are total care. Don't forget to turn and reposition them every 2 hours. Take them off the bony prominences. You want to take them off the sacrum, because patients, when they are on their sacrum, they are critically ill. Sometimes they are malnourished, not getting enough proteins. They are at risk for skin breakdown. Which client would be most likely to develop a pressure ulcer from shearing force? We spoke about shearing force. The answer is clients who are sitting on a chair. They are most likely to develop a pressure ulcer from shearing force. These patients sitting on the chair, sometimes you have to keep pulling them up and down in the chair. Sometimes you put them out in a big armchair and they're jumping out of the chair. You have to keep pulling them up. This is shearing force. On the sacrum, you're pulling them up and down. That creates shearing on the skin. This creates risk for skin breakdown. Patients who are total care, critically ill, they are frequently sliding down in bed. You have to continuously pulling them up and down in bed. Clients that are most likely to develop a pressure ulcer from shearing force are patients who you have to pull up and down in bed, or patients who you have to pull up and down in a chair. Which guidelines would you consider when you're irrigating a wound? When the doctor orders irrigation of a wound, the answer would be when irrigating a wound, keep in mind that irrigation can cause trauma to the wound. So when you're irrigating your wound with a syringe, don't just force out all that water on the wound. The water you're using to irrigate the wound, make sure it's done gently, because force of that water can create trauma to the wound. Force of irrigation can force bacteria also into the wound. When you're ambulating your post-op patient, and say your patient say, "Nurse, I cannot go any further," and your patient is like getting ready to fall, what do you do? You're all alone. What do you do? You can't afford, there's no chairs around, there's no one to help you maybe. The first thing you do, if your patient begins to fall, you slide your patient down your body to the floor carefully, protecting the client's head. So if your patient is getting ready to fall, you hold the patient maybe around her waist, go behind her, and just tell her to slowly move herself to the floor. Gently, please. So you slide your patients to the floor gently to prevent your patients from falling to the ground, prevent your patients from head trauma. You have to protect your patient's head, so you slide your patient slowly to the ground. What are your isotonic exercises? Your isotonic exercises are swimming, jogging, bicycling. Which crutch gait is weight bearing permitted on both legs? Your answer is 2-point gait crutch walking. What is the characteristic of REM sleep? In REM sleep, the patient eyes dart back and forth quickly. In REM sleep, that's a stage of sleep where patient experience dreaming. Pain that is localized and originates in the body is known as visceral pain. What are your water-soluble vitamins? Your water-soluble vitamins are B and C. What are your fat-soluble vitamins? They are A, D, E, K. Don't forget, when you're tube feeding your patients, either by a GI tube or an NG tube, don't forget to follow the doctor's orders of checking residuals. Usually the order is every 4 hours. We are checking residuals to find out whether or not your patients are tolerating the tube feeding. Please hit the thumbs up button. Please subscribe. Please share my video. Thanks for watching. Have a good day. Thank you. Stay tuned for the next part of my exam. Thank you.